Well, awesome. This is a particular topic that I'm very passionate about because this can be the difference between helping you, truly helping you, and actually harming you if we focus on the wrong thing. Now imagine that you're driving somewhere in town and you don't know this particular town and you're using one of those GPS units and you're basically following a little dot, that is telling you turn right, turn left. Suppose somebody tampered with that and reprogrammed it unbeknownst to you and put a different address on it. By the time you get to your destination, you're not going to be where you think you are going to. And can you see how devastating that can be? You spent an hour driving, you spent several months in therapy, and you're not where you think you're going to be. So the point I'm making here is that we have to navigate by the right aids. We have to have the right signs on the road. We have to have the right objectives to pursue. Otherwise, we might end up at a place that we did not want to be in. So this is extraordinarily important. Think about this. There's a huge difference between feeling better and being better. Let me give you an example, an explanation of this. A person comes in and says, look, I'm having this huge problem with my neighbor. In different lessons, I explain why I use the example of the neighbor. I don't mean necessarily the person that lives on the unit next to yours. I just use the word neighbor as, the fellow human being. I'm having a huge difficulty with my boss, with my father, with my mother, with my wife, my husband, that kind of thing. I'm having this huge problem. And I tell you, okay, well, what's going on? He says, well, look, he does this, he does that, he does this, and he does that. And I tell you, oh, John, let's just suppose the person's name is John. I'm making this up. Oh, John, I'm so sorry. You're so right. Under those circumstances, I would be livid as well because that person is really mean. As a matter of fact, I'm an expert on this topic and I can tell you that your neighbor is actually a bad person. We got to find a way to get rid of this person, and on and on and on and on. And I'm telling you, right now I'm kind of making this up and it seems a little exaggerated, but if we did this just right, you would feel great. In other words, you would feel initially like a perfect victim who has been vindicated, and you're going to feel empowered by the fact that some sort of authority figure, such as your therapist, agrees with you that the other person is actually the bad one here. You will feel better, I guarantee you, at least initially, but it won't make you a better person. And as a result, in the long run, if we proceed along that road, eventually you're going to discover that you're not healing. And that's when you're going to resent yourself for having wasted time, and to a certain extent your therapist for not guiding you correctly. Now let's look at the alternative. You come in and you say, look, I'm having a problem with my neighbor, he does this and this and this, and I look at you and I say, all right, now let me ask you a question. How come you are attracting this experience into your life? What is it about you that needed to live this experience, else you wouldn't be there, right? And you say to me, whoa, I'm feeling a little attacked right now. I'm not feeling very comfortable. Why are you saying this? So you're saying it's my fault? See, then we get into this huge explanation. The point of this particular discussion is the following. No, I'm not saying it's your fault, but by treating you like a perfect victim, we can actually make you feel better and get absolutely nothing done. Whereas if we go at the only thing that matters, the only thing that we can change, which is you, then initially you're not going to feel good because we're going to touch precisely the points that are not comfortable for you. We're going to get you out of your comfort zone pretty much immediately. You're not going to feel comfortable and therefore you're not going to feel good. And yet that will lead you into being a better person. So there is a huge difference between working towards making you feel better and working towards making you better, be better. See, be better, feel better, completely different concepts. In some cases, they're completely antagonic. In some cases, they're completely opposite. Now, it turns out that when we work only to make you feel better, we're almost guaranteed to make you a worse human being. For instance, I'll give you an example. In the movies, you see this all the time. Children who are, quote-unquote, spoiled, the parents are continuously trying to make them feel better, and they keep on damaging them more and more and more. I see this in the movies all the time. So in some cases, reprimanding a child the appropriate way may not feel good to the child, but it might make them a better adult. So you can see here how feeling better and being better can be very different concepts. Now, it turns out that when a person is better, when they become a better person, they also feel better. Whereas the opposite is not true. When they simply feel better right now, they're actually becoming a worse person. But if we can help you become a better human being, I guarantee you, you're going to feel so proud of yourself with your own accomplishments that of course you're going to feel good. Of course you're going to feel better. That's the whole point of the service. And that's exactly what happens. But you're going to feel good as a result of what you have accomplished, not as a result of somebody stroking your ego. Now, why is this absolutely crucially important? This comes up a lot when a person says, well, I just want to go for one session to see if I like it. And people are always surprised because conventional therapists would be glad to jump on that opportunity because this is exactly what they do. They say, okay, come over for one session, see if you like it. What do they do during that session? They basically stroke the person's ego so they like it and they come back. What did they just get done? Absolutely nothing. Absolutely nothing. It's very easy for a typical therapist to make you feel good for a few minutes. You're such an interesting person. We say some meaningless things. I don't, but some people do. A couple of meaningless ideas such as, oh, you're so special. Oh, I can see that you're a really special person. And some people become seduced by that type of feedback and they find, wow, I feel good. I like this therapy. I want to come back here. Okay, let's do a few more sessions and we'll continue going. Absolutely nothing got done. So when a person calls me up and says, I want to come in once to see if I like it, and if I do, I'll continue seeing you, I tell them, don't bother, because I can tell you for a fact you're not going to like it. In fact, the first session is the most difficult session because it doesn't take me more than about 5 minutes talking to get you out of your comfort zone and touch the sore button. It doesn't take long at all. I've been doing this for 20 years, and everybody tells me that, whoa, you're quick. I mean, whoa, you get right into it. It's like, wait, why are you here? To socialize or to get right into it? But it never fails. It takes about 5 minutes because that's all we do. It doesn't take very long because your unconscious is always announcing itself. It's always, expressing itself, and it doesn't take long to pick up on those clues, get you right out of your comfort zone so that we can touch the right buttons and make the right adjustments. The point is not to make you feel uncomfortable, but I can tell you that if we're to get anything at all done, therapeutically speaking, the most likely result is that you're not going to feel very comfortable. You're not going to like very much because it's going to be a little bit disconcerting. But we're going to get something done. We're going to identify a few problems, and then we're going to solve those problems. And you're going to be a better person. And by being a better person, you're going to feel good about yourself. So a person that, in 20 years, we've seen over 7,400 people by now, and I have noticed that those who do the best with therapy, they don't come in here once to check it out to see if they like it. They come in here already committed. They're ready to go to work. And they appreciate the quickness with which we get them off their comfort zone and touch the right button so that we can go right to work. And I think you're going to appreciate the same thing as well because you have a life to live, and your life is not happening inside of our office. Your life is happening in your life. So the quicker and more effective that therapy can be for you, the quicker you can get back to your life. And that's the whole point of this service. That's why it's so valuable.